Well, why don't we go ahead and just start talking about public policy? So, what I'll send you a little later is what we've had is a mother who has two children with both in their 20s. They have muscular dystrophy. They've been on artificial ventilation at night. They have gastrostomy tubes. The mother and the director of maternal and child health and myself have really fought very hard to put together a system with private insurance from the mother's work in the schools, the megancall for what they can do, SSI for what they can do. And so when she reads Ezekiel Emanuel's missives about the Reaper curve, where what's the worth of a human being, and what's their place in life, and are these bills going to get leave her children behind? Are they going to take away services that really lead them to have a good life? So that's really where we're at. But tell us a little bit about yourself, Megan. Where are you going to school now?
I am going to Duke. I am getting my master's in public policy, focusing on health care policy. And it's a 2-year program. I've just begun my 2nd year, and I spent my summer interning in Senator Kennedy's Health Policy Office as part of the Senate Health, Education, Labor, and Pensions Committee. So I've been there through all the markup of the Affordable Health Choices Act, or health care reform, as it's more lovingly referred to. So, I was definitely on the team that's trying to make some changes in the way we do health care here.
Well, I think you've seen the letter from her son, who's writing to Barbara Boxer, and is really getting to know the ins and outs of all of the bills. I think probably the hardest part at our end is what's happening with the Obama death panels and all that. Is there a sane process going on behind the Senate doors and the House of Representatives doors?
Well, certainly behind the Senate doors, there are no death panels. I believe where that got started was the notion that Medicare would cover some of the, if senior citizens or people on Medicare wanted to get advanced directive counseling every 5 years, Medicare would cover that. So it was expanding a service. It was never intended to become the storm that it has.
We have a physician, Dr. Hornstein, who has given us an excellent presentation on the physician-ordered life-sustaining treatment that we have here, where people we want them to engage in a dialogue with their physicians. Certain insurance companies are pushing that the director of nursing in these large nursing home facilities will just have their physicians sign them off and not really talk to the patients. So we're really trying very hard to make certain that proper conversation occurs. And I think really that's what the bill has, that advantage. The other thing we worry about is, of course, diversion of money away from children. And Ezekiel Emanuel's Reaper curve, that first 2 years, we don't want to spend quite so much money in the first 2 years and the last 2 years of life. How do you see that behind the doors there in terms of covering immunizations and well child care, and about 16% of kids have some kind of special health care need? It might be attention deficit disorder, might be diabetes, might be cystic fibrosis, might be muscular dystrophy. How do you see the health bill supporting the continuing care for children?
That's not an issue that I know that much about. What I do know is that there's money in this bill for all sorts of prevention and wellness programs. Some of it's been derided as, it's pork money for sidewalks and playgrounds. Well, it's money for sidewalks and playgrounds where kids don't have places to run around outside and exercise and stave off things like diabetes and obesity. So, while I can't speak to the specifics as to what it will and will not fund, I know that prevention and wellness is a big component of the bill.
Yeah, certainly when we've looked at obesity here in Ventura County, we're looking at 30 to 40% of our 4-year-olds are on their way to morbid obesity. We've done carotid intimal medial thicknesses showing carotid arteries narrowing already in 10-year-olds. And when we take a look at the amount of parkland and the distance that children are allowed to go away from their homes, it has shrunk and shrunk and shrunk. So you're exactly right. We really, as pediatricians, want to do a warm handoff. We want kids who can read the directions on the medication, their parents to be able to read the directions on the medication. We want them to have exercise as part of their life, to have proper nutrition as part of their life, because it's going to prevent gallbladders being taken out, kidneys being transplanted, type 2 diabetes, uh, early death, but very expensive care for adults. Uh, the medical home concept, is that something that you all have been discussing too?
Mm-hmm.
So in terms of medical home, of course, we provide it for children with special health care needs. We have the teams for cleft lip and palate and teams for cystic fibrosis. We concentrate care, but really what we're hoping to support is better support for the physicians for all the amount of time it takes to call UCLA to get home IVs, to fill out school papers, but also to really sit down and do some counseling. My understanding is that the internists are asking for $50 a month for a medical home for the adults, and pediatricians are, oh, please, can't we have $5 a month, and we'll settle for less if so. It's a complex issue, but as you start multiplying out the numbers, where is this money going to come from?
Yeah, that's beyond the purview of an intern.
So it's in public policy. Do people look worried around you, or when you have these behind-the-door meetings, what kinds of things go? Do you put up pieces of paper on the wall and here's all the things we'd like, and then start voting?
Yeah, a lot of negotiations went in before I got there. I know that there had been formal writing of the bill for at least a year, and talks for many more than that. There were some very impressive people in the office. There was an ER doctor who was a fellow working on systems delivery reform, and so a lot of very well-informed people trying to maneuver and put this bill together. And it was interesting when I first got there. It was the first time that they had actually said, okay, we're done, we have a bill. And so the first week everyone was like, oh, what do we do now? We just wait? And so then, the hearings and committee meetings started, and that was really interesting. I'd say that watching what the senators had to say, there was definitely concern about, how much is this going to cost and how are we all going to pay for it? That was actually, frankly, beyond the scope of what our committee was allowed to do. Our committee can't make tax policy. We can make recommendations to HHS and things that we think that the government should fund, but we can't actually find the money for it. That's not what we're allowed to do. We have to wait for the Finance Committee for that.
Yeah, just watching out in public, it looks like there's maybe 5 different bills, and people don't know which one to defend, and they look a little unsettled. But I think the important parts are the important parts of the bill seem to be, or what's needed to happen in terms of patients with chronic illness not being denied care as they run out of lifetime benefits, and people who have pre-existing illnesses not being denied access to health care. I think there's some very important issues, and it really sounds like physicians and with skin in the game, people have been there and have been able to have good input here. So, all right. Well, it's time for me to wrap up from the noise in the background there. Where are you going to be over the next year? What's up for you for the next year here?
I will be completing my MPP at Duke. A large part of that will be devoted to a master's project where I will be consulting with the Teen Pregnancy Prevention Initiative, which is part of the Division of Public Health in North Carolina, to help them improve their outreach and reach the most affected counties with this problem. So that's what I'm looking forward to right now.
Well, that sounds great. We had a large problem with teen pregnancy in one of our junior high schools. So we started in 4th grade in terms of intervention, and it does take sometimes 5 and 10 years to see the fruits of your labor.
Mm-hmm.
All right. Well, thank you so much for giving us that little inside scoop, and Good luck with preventing pregnancy in North Carolina, and good luck with the rest of your studies and the rest of your life there. Thanks for joining us.
Thank you, Dr. Landon.